when we think about the experience that our patients have of the practice, I think there's some things we're doing much better as a big organisation. I think there's some things we're probably at the moment doing slightly worse, actually, to be honest with you, that we know we need to work on. So our same day access is excellent. It really is. All our patients know that if they need something, they'll be dealt with that day, and we have pretty much unlimited capacity on the day, so we never turn people away. We've got pretty good online access. We have had some issues with the phones, but people generally can get through on the phone now. And with our patient care coordinators, who are a point of contact for more needy patients, I think we're doing quite well with more rapid access to services. What we struggle with is the continuity. It's partly because of our size. It's also because increasingly we've got a workforce made up of clinicians who are not working full time, who are doing 2 or 3 days a week. Some of our doctors only do 3 sessions, so it's very hard to provide the continuity. And also, if you're putting resource into providing really good on-the-day access and making clinicians available to that, it reduces their availability for routine appointments. So that's a piece of work that we're doing at the moment. It's one of the things we've identified that we really need to work on, is how do we do better at providing continuity for patients. I think you've got a big group of patients who frankly don't care. They just want to see someone at the time that suits them, and they're not that bothered about who they see. But patients who have a longer term condition or a mental health problem or are more complex or vulnerable, they do need the continuity, and sometimes we struggle to give them the appointment with the doctor they want when they want it. So our clinical directors are now leading a piece of work looking at our more vulnerable patients and thinking about how we flag them up and how we give them preferential access and how we start to deal with them in a more planned way. It's going to involve more us contacting them to proactively give them appointments rather than waiting for them to contact us. And I think that's an area that we've got capacity to deliver. It's taken us 2 to 3 years to really get stable as a new organisation and to start to get every bit of the organisation functioning well. We now feel like we're in a place to really start developing our service offer.